People, this is Samuel Sane from Kenya, here at Gleneagles Hospital, Mumbai. I have a special guest, a special doctor, a learned doctor, one of the best doctors in the world. He's a
cardiac
surgeon, Dr. Pavan
Kumar.
Say hi to our people.
Hi, hello, Mr. Samuel.
Yes,
nice
sir.
meeting you.
Thank you, doctor.
I'm adult cardiac surgeon,
Uh-huh.
consultant cardiac surgeon,
Yes.
working at Gleneagles Hospital.
And why do you like working here at Gleneagles Hospital?
Oh, it's one of the best hospitals in the town, and it has multi-specialty facilities available, and especially in my field of cardiac surgery, where all the equipments, best care
Yes.
in the cardiac surgery field. Since the inception of this hospital in 2013, I guess, I've been associated with this hospital, and we have performed not many heart surgeries.
Yes.
And heart surgeries are basically coronary artery bypass surgery for heart attack disease, heart valve repairs and replacements for heart valve disease,
Yes.
like aortic valve disease, mitral valve disease, aortic valve replacement surgery, mitral valve replacement surgery, complicated heart surgeries like aneurysms of the heart,
Yes.
left ventricular aneurysms of the heart, aortic root surgery, redo surgeries, heart failure disease surgery, all kinds of adult cardiac surgeries we are doing at the best. And as far as my experience goes, I have been practicing adult cardiac surgery in Mumbai since 1992.
Since
1992, yes.
I was very young.
You were very young, yes, I guess.
And for how long have
yes.
you, in total, for how many years have you been
Oh,
practicing?
well, I did my specialization from AIMS, All India Institute of Medical Sciences in Delhi in 1985.
1985. 1985, I don't want to disclose my people how old I was. I was very young boy. 1985 is quite a long.
Yes. Then I went abroad to Sweden and London.
Sweden and London.
Yeah, and had the famous Karolinska Heart Institute.
Yes.
Where the Nobel Prize is the next door.
Yes.
The Nobel Prize is decided about.
Uh-huh.
So I was there. Then I was in London in Harefield Hospital for heart transplants and training and all. And I returned back and worked in Delhi at Escorts Heart Institute for 4 or 5 years.
Yes.
Then I came to Mumbai in 1992.
1992.
Started at Hinduja Hospital for 6 years. Then I went to Leelavati Hospital.
Yes.
And then onwards, I'm at this hospital.
Wow.
So over last 26 years
26
of
years.
adult cardiac surgery in Mumbai.
In Mumbai.
Done around 16,000 heart operations. And
16,000?
16,000.
1 to 16,000 operations.
Heart operations, yes.
Heart operations.
Heart operations.
Doctor, tell us, which are the commonest cardiac problems you have ever encountered?
I get a lot of patients from Kenya. So, pertaining to your country and that belt of African countries,
Yes.
lots of heart valve disease occurs. Mitral valve disease, aortic valve disease, and then now coming up is a coronary artery disease, the heart attack disease.
Heart attack.
So in those times also we used to get a lot of patients from Mombasa, from Nairobi,
Yes.
from Kisumu.
So, no.
So, lots of friends of mine are.
So you have been in Kenya?
I've been to Kenya for many times.
Ah.
We used to run clinic there.
We need you there. We want to welcome you back in the country.
Sure.
Yes.
We were
Where
lots,
is it?
lots of Hindu community. The Hindu
Yes.
community. There is a place where we used to go run clinics.
Nairobi Gymkhana, you know?
Yeah.
Nairobi
of
Gymkhana,
course.
down there?
Yeah.
Ah, that is
And
nice.
then in Nairobi they started doing angiographies,
Mhm.
the heart surgeries. So I used to go there and do some training for those people. Lately, 10 years I have not been there to Kenya.
Uh-huh.
But important point is that used to get a lot of heart patients from there.
Yes.
And we used to do bypass surgeries and valve replacement surgeries. And you'll be glad to know that I had 100% success in all patients, those who came from Kenya and
Yes.
those places.
Yes.
Recently came from Zanzibar, from Tanzania.
Tanzania,
patient.
Zanzibar down there.
He was very complicated case. We did very good.
Uh-huh.
That way.
Which one was that? What
So
was
very
the
bypass
problem?
surgery plus valve replacement. It was a complex case. Aortic valve was replacement done along with the bypass surgery.
Yes.
So it was a 8-hour surgery.
Uh-huh.
So we did that. And you will be glad to know
Yes.
that over the last 4 or 5 years, it has been 100% success in
Yes.
my cardiac surgeries. Not a single mortality, not a single complication.
Yes.
Everywhere went well.
Uh-huh.
So that will be a glad thing, a good thing to spread the news. How excellent care, hospital care,
Yes.
and our surgical expertise gives the best results.
Yes. Doctor, what causes heart attack?
Well, a very important question, the same one, and everybody should know that stress,
Yes. Stress.
mental stress,
Mental stress.
yes,
Uh-huh.
blood pressure,
Blood pressure.
smoking,
Smoking.
drinking,
Drinking.
and high cholesterol food, lots of fat.
Yes.
These are the main causes of causing heart attack.
Uh-huh.
And nowadays we get a lot of young patients getting heart attack.
Because
They are
of
obese.
lifestyle.
They are obese.
Yes.
They eat a lot of junk food. So that's where they get into. And now we are getting patients those who are under 40s
Yes.
and they are getting heart attacks. So it is very important for you to know and you to tell people in Kenya that obesity, lifestyle has to be changed if you want to prevent heart attack.
Yes.
And if your family has a heart attack disease, do get a cardiac checkup done so that you know
Yes.
that you are not going to get a problem, get
Yes.
into problem of a heart attack.
There's so many cases in Kenya of blood clots. What is this that has been causing all these problems with the cardiac issues?
That is very important, especially after corona epidemic. This has become very common. Not only common, I mean, there is some kind of blood clot mechanism which is deranged now somewhere. Either maybe because of their disease, the body style, the lifestyle,
Yes.
their food habits. So blood is getting thicker and thicker, and hemoglobin is going up, 15 grams, 16 grams, like that. So blood is thick, and
Yes.
that is where the clot formation occurs.
Doctor, let me ask you. You think the vaccines brought all these problems? Corona vaccine, I mean.
It's a controversial thing, but I'm more on your side. I have seen lot of complications after vaccination, especially mRNA vaccination. The one which was given by the American companies.
There was Moderna.
mRNA vaccine. The vaccine. Pfizer. So there was a lot of research, and suddenly you find that it is causing clot formation.
Yes.
It is causing a lot of kidney damage, lot of heart disease because of the dilated cardiomyopathy, and then heart function going down.
Yes.
So this was very often observed. Although it was not published in research papers
Yes.
because of certain, international guidelines
Yeah.
and maybe under guidance of WHO, but we have seen
Yes.
this thing by our own eyes. So that would be.
As a doctor, I trust you.
Yep.
Yes. Now, tell us what can we do to prevent this kind of blood clots?
Basically, first thing you have to understand that what is your coagulation mechanism in the blood. You must screen your coagulation profile, clotting mechanism profile. If it is deranged, then you know what kind of factors you are either lacking
Yes.
or they are acting excess. If your platelet counts are higher,
Yes.
why it has gone higher?
Yes.
That you must know. So like you should do a full coagulation profile and get your homocysteine checked up.
Yes.
If homocysteine is high, that means platelet aggregation is going to happen, and that will cause the clot formation.
Yeah.
And then secondly, if you have this kind of tendency, normally, like even after corona,
Yes.
we used to keep these patients on anticoagulants, oral anticoagulants, blood thinners,
Blood
for a long time.
like aspirin.
Not only aspirin, but
Yes.
the newer anticoagulants like Eliquis, Apixaban,
Yes.
what you call. So we used to keep them on 6 months, so almost a year or so, and watch if there is any clot formation, because lots of patients came with a stroke,
Yes.
brain stroke, because of the clot formation.
So, stroke is one of the heart-related problems.
No, stroke can, in common man's language, in your language, can be a heart attack. But in our language, in medical terminology, stroke is usually related to the brain. If clot goes to the brain,
Yes.
that causes stroke. If clot goes to the heart vessels, it causes heart attack.
Heart attack. So, good lifestyle actually improve good health.
Absolutely. But before, with that, you must get your cardiac checkup done.
Yes.
Annual cardiac checkup done. If you are 35 years above, you must get your cardiac checkup done. Get your blood picture cleared up.
Yeah.
Get your organs like liver, kidney, all vascular structure.
Yes.
Get that thing checked up.
Yes.
And if you have disease, then get yourself investigated.
Yes.
Because only after investigation you will come to know that you have a disease and now treatment is available. Like heart.
Yes.
Heart disease, if you diagnose as a heart disease, then that means you are curable. You take the medication. If you have multivessel disease, get a bypass surgery done. If you have valvular disease, get your valve operation done.
Yes.
Because these operations are now 100% safe, complication free, and gives you great long-term result. Yes.
Doctor, tell us which machines or medical equipments that make your work easier in your cardiac surgeries?
Diagnostics
Yes,
are investigative.
Investigative and evaluation machines.
Machines basically are echocardiography machine, stress test machine, and rhythm monitoring machine like Holter monitoring.
Yes.
These are the three important machines which you should be keeping in nearby nursing homes,
Yes.
so to know the cardiac illness. And then ultimately, finally, it's a angiography, cardiac cath lab. Angiography.
There is cath lab and angiogram. What is that?
Cath is a laboratory. It's a room. It's a suite.
Cath lab.
The suite is called as cath lab. In that there is a machine which does cardiac catheterization. Cardiac catheterization, where you put in a catheter and do inject a dye in the heart vessel. That is called as angiography.
Angiography.
Yes.
Yes.
So angiography will show you blockages in your coronary arteries. If you have any valvular disease, then you do cardiac catheterization. We measure the pressures in different chambers of the heart. So we know which valve is diseased, which valve is leaking, which valve is narrowed, and what kind of treatment options are available to that kind of disease.
Yes.
Yes.
Oh, that is clear now.
Yeah.
At least now I know.
Yeah.
There is some cases like VSD, ASD.
So
conclude with this.
So basically, there are hundreds of varieties of the heart disease. One spectrum of heart disease is in the congenital heart disease, by birth defects.
Yes.
One is acquired heart disease, and one is elderly heart disease.
Yes.
So by birth defects are these. There are some holes in the heart which are not filled up during the development of the heart. So that one of the holes between the main chambers of the heart, left ventricle and right ventricle, if there is a septum, there is a wall kind of thing, a curtain kind of thing, which separates left ventricle and the right ventricle. If that curtain is deficient somewhere, it creates a hole. So left side blood goes into the right side blood. It's a flow of the blood, mixing of the blood, good blood and bad blood through that hole. So that hole is called as ventricular septal defect, or VSD.
Yes.
If there is that hole is in the upper chambers of the heart, left atrium and right atrium. So that is called as atrial septal defect. There are two types of defects, the atrial septal defect and ventricular septal defect.
Wow, I didn't know all this, but thank you, doctor, for telling us all this and advising us. As I conclude, I had a young baby, an infant, cannot go surgery. Is it true?
No, not at all. Not at all.
Because the heart, I was told, is so small.
No. In fact, our cardiac science has advanced so much. Now we are doing fetal surgeries, fetal interventions. When baby is still in the womb, in the uterus. Yes.
You can do surgery.
Sir, we can
You can
do surgery.
detect,
We can
diagnose.
we can diagnose, we can do intervention,
Mhm.
whether if there is a hole in the heart, or
You
if
do
there,
it.
if there is a abnormal, what you call, tube connecting different chambers, you can close that tube,
Yes.
so the heart develops properly. And the fetal surgery,
And how will you do when an infant is
under
a fetus
ultrasound,
in the
under ultrasound, under sonography guidance, we put in a needle, we put in a wire through that needle, throw a womb, throw fetal heart, and then do that. It is being done.
Doctor, you're
Very,
making
yes,
it.
yes. This is what is advancement, and that is where your knowledge will improve.
Okay.
The awareness among the public. Yes, the fetal surgery can be done. Surgery can be done at the 1 day old baby, newborn baby.
Yes.
It can be done within 10 days of surgery. There are many varieties of the birth defects
Yes.
where heart requires quick surgery.
Mhm.
Otherwise, heart will fail
Yes.
within hours. So we have neonatal surgeries, specialist departments
Yes.
in the country, in the town, where this can be done.
Wow.
Yep.
That's good. Thank you, doctor, for your word of advice.
It was a pleasure talking to Mr. Samuel.
Knowledge and
And
wisdom.
with final word
Yes.
from my side is that I've been practicing heart surgery over the last 26 years in Mumbai, especially in Gleneagles Hospital. It is one of the best hospitals in the town in the country, and we provide all kinds of heart surgeries safely, and all complicated heart surgeries can be referred to us through Mr. Samuel,
Yes.
or you can also log on to my website, which is www.drpavankumar.in, and I have my Facebook page and I have got my Twitter account at Dr. DRPAVN7 and Instagram photo. You can log on to my website, get all the information. Thank you very much, and I'll be glad to provide any kind of best expert services for any heart disease related problems. Thank you.